Now we'd like to show you the highlights from 3 recent Red Resus simulation examples: non-invasive ventilation, an adult trauma call, and a neonate with critical illness. The ED team have received a pre-alert for a gentleman in his 60s who seems to be suffering from an exacerbation of COPD. The ED nurse and doctor talk through what equipment and guidelines they want to get ready. The cannulation trolley is brought into the room and kit prepared, and the doctor reviews the guideline ahead of the patient arriving. The paramedic handover reveals an hour of nebulizers and targeted oxygen therapy, so the clinician knows that an arterial blood gas will be important early in the patient's episode to help decide whether this maximal medical therapy has been sufficient to avoid NIV. The ABG reveals a type 2 respiratory failure, and so a chest x-ray is obtained to make sure there isn't a pneumothorax prior to starting NIV. The NIV machine is brought in from the main area of Red Resus, plugged in, and the oxygen piping attached to wall oxygen. Then a member of staff trained in using the NIV machine can turn it on, run some checks, and create the settings appropriate for the patient. The most appropriately sized mask from small, medium or large should be selected for the patient. And prior to starting NIV, viral filters should be sited within the circuit, and the team need to don full PPE as this is an aerosol generating procedure. A pre-alert call has been made by the paramedics. The information given is of significant concern to warrant a trauma call. This is placed by calling 2222 and asking for an adult trauma team. Meanwhile, the ED medical and nursing team start preparation in Resus 7. The trauma trolley is brought from the main area of Red Resus into Resus 7 and opened, and the team prepare kit they anticipate they may need, including a PAT slide and sheet to transfer the patient from the pre-hospital trolley onto the ED trauma mattress. They might also get ready a pelvic binder and C-spine blocks and tape. The eResus package of guidelines can be accessed using the touchscreens which you'll find in each Red Resus room, and for this case, the trauma package of guidance is opened. When the patient and crew arrive, unless there has been significant deterioration, it is good practice to transfer the patient prior to handover, and then for the whole team to listen to handover without starting any tasks. This is known as a hands-off handover. Then the trauma team leader can direct the team to start the A to E assessment of the trauma. Occasionally, this can include early support from radiographers who can do mobile chest and pelvic x-rays if the patient is too unstable for immediate transfer to CT. Meanwhile, the team might decide to activate the major hemorrhage protocol, details of which are found on eResus. This requires careful and regular contact with blood bank, so the team leader needs to identify a clinician to take on this role, plus an ED porter to be the runner to blood bank. And if the patient is suitably stabilised, the next step would be to speak with the radiologist to organise appropriate trauma imaging.
Called Leo, who today has become unwell, not feeding for the last 12 hours and now seems breathless and sleepy.
Given the concerning pre-alert, the ED registrar decides to contact the PEDS team for support. When the baby arrives, they are laid feet first onto the pre-warmed resuscitaire, and a cannulation pack is retrieved from the large cupboard and brought near patient on a procedures trolley. These large cupboards on the left of the room do contain a huge amount of monitoring, treatment, resuscitation and airway kit, so do familiarise yourself. And fluids and paediatric documentation is kept in a smaller low cupboard in the corner. Again, eResus is very helpful in supporting your critical care of this very unwell neonate, which in this case has a duct-dependent congenital cardiac lesion. The child progresses to needing an aerosol generating procedure as shown here, so full PPE is required for the whole team in the room. After involvement in a challenging and distressing case, there may be a role for hot debrief as well as referral to trim. So to summarise the learning from this video, we have 4 beautiful, well-designed and well-equipped rooms down in Red Resus, but they're only as good as the team working within them. So please visit ED to orientate yourself, and if you're able to, attend our monthly ED Big Sim. Be aware that PPE, particularly full PPE, inhibits communication, so the team needs to keep unnecessary noise to a minimum, and use closed-loop verbal communication, the whiteboards in each room, and regular team leader summaries to ensure that the case progresses safely and effectively. Thank you.